We're a very small practice. We've been around a very long time. We started out owning equipment in an imaging center, and over the years have transitioned to being hospital-based only. I currently have 6 radiologists, do about 240,000 procedures a year. Right now I have a staff of about 4.5, and looking at paring that down with some more automation. AI is a huge buzzword. I think AI scares people, and I think if they looked at it more as automating what you can. And for us, there's still things that we do on a daily basis, whether it's processing charities that we work with our hospital closely, but just repetitive things where you're going in and making the same changes constantly and having to go back and monitor. Being able to automate those pieces as well, again, impacts not only staff time, but gets the staff's hands on the things that they need to, not the repetitive pieces that the computer can easily take over for us. AI can be intimidating. We're in a situation of having a long-term person who'd been with us for 22 years that left. Even finding somebody who has skills does not have the skill set of somebody with 22 years in the same practice. And so AI for us really is about, again, streamlining and automating the pieces that I can get my staff's hands off of so I can keep their hands on the stuff that they do need to do. They answer phones, they talk to patients, they have empathy and sympathy. I don't need that for simply turning a rule off and on. And that's where automation comes in. You want to really evaluate what you can take hands off of and what you want your staff to be working with. You know, going back to when we looked at systems, it was tough because you don't know what you don't know. And that truly is a huge issue. Automation, having the system do as much as it can for you, it's not about replacing staff, it's about making your staff work better, smarter, hands-on the things that a computer can't do, dealing with patients in the manner that they should, but letting the software take over where it can. So you really want to do your due diligence of what can it do for you, talk to clients that use it. They're the ones that can tell you whether or not it works and if it works well. And it's really a team effort. I can't do this without Imagine. Imagine can't do it without all of us. But together, coming to this conference allows us to interact and really all become better and stronger. I got used to every 5 years replacing software, and I think that's what most of our medical groups have done over the years. It's nice to be into a first decade and then some, and not have any plans to have to go elsewhere. How flexible the system is and how much we as end users can do. Having a long-term person leave means that we get hands back on everything for a daily basis for a period of time. And the number of tweaks that we've made to everything from mass charge write-offs to criteria builder, to even looking at how our appliance runs our existing processes that we can do in a better manner, really has reminded us how powerful this system is. There's not much out there that can compete. It is almost intimidating sometimes in how powerful it is, but what it does do is it makes the staff want to do their jobs because they have a system that works with them, and that's a huge benefit.